Hi, everyone. So we were asked about social and public health transformation this week. So communication has long been recognized as a powerful tool in the realm of public health and social transformation. The ability to convey information, raise awareness, and influence behavior is central to addressing the many challenges that our societies face. The articles we read this week explored the overarching themes and commonalities related to the use of communication in these contexts and discussed how we can collectively apply these strategies and frameworks to create a healthier, more equitable, and socially responsible society. One of the key themes I found within the article was that using communication as a catalyst for change and the role it plays in educating and raising an awareness. Um, Public health campaigns often rely on clear and engaging communication to disseminate information about diseases, prevention, and treatment. Social justice movements harness communication to educate the public about systemic injustices, building empathy and support. The commonality here is the need to inform and engage, which can be applied collectively through leveraging mass media, social media, and other communication channels to disseminate educational materials and foster awareness on health and social issues. It can also be through sharing personal stories and narratives that humanize issues and make them relatable to a broader audience, much like the Papa article when they used parasocial perspective. I love parasocial. I think it is the most interesting subject there is. And that was a very interesting article. Another theme found in the articles was how communication and in public health and social transformation has the ability to drive behavior change. Communication strategies can motivate individuals to adopt healthier lifestyles, support social justice initiatives, and advocate for change. We see these things a lot in our everyday. I get ads all the time in social media. The commonality is the persuasive power of communication and we can collectively apply this by crafting messages that resonate and with specific target audiences and address their unique motivation to barriers to change. Harnessing the influence of social norms and peer groups to encourage desired behaviors and societal shifts, and utilizing evidence-based approaches to design campaigns that effectively promote behavior change. In times of crisis, effective communication is also essential, and another theme that I found throughout. Whether it's a disease outbreak or natural disaster, the public relies on timely, accurate information to navigate difficult situations. These principles can be applied by developing and implementing vigorous crisis communication plans at various levels of government and within organizations, establishing trust with the public through consistent, honest, and empathetic communication during crises, and ensuring that information is readily accessible and available in multiple formats, languages, and channels to reach diverse populations. Now, in the modern age, digital and social media platforms are essential tools for communication. In the Maybach 2007 article, they discussed marketing and the new contemporary ways in which to use new technology. This article is rather old, but they had a point. Using new technological platforms allow for real-time engagement, information sharing, and advocacy. The common theme here is the power of the power of technology in reaching and mobilizing people. To collectively apply these principles, you can promote or people can promote digital literacy and responsible use of social media to prevent the spread of misinformation, which we've seen a lot lately, especially in health related contexts. Collaborate with influencers and leverage trends to increase the reach and impact of health and social campaigns. Use data and analytics to measure the effectiveness of digital campaigns, allowing for adjustments to maximize impact. Communication is a cornerstone in creating a healthier, more equitable, and socially responsible society. its ability to educate, motivate, manage crises, address injustices, and harness the power of digital platforms makes it a very versatile tool. To apply these strategies and frameworks collectively, we must prioritize education, behavior change, crisis management, social justice, and digital literacy. The power of communication lies not only in its message, but in the unity of purpose it fosters among individuals and communities. So my question for you this week is I already have my master's in PR, and I've done a lot of PR work over the years. So I want you to maybe get a little creative in your answer. What would you do, or how would you develop something along the lines of a campaign used for these purposes? Um, I've always said that health comm should have some kind of health related crisis management class, or even a section in a class. So how would you implement these practices inside of a PR campaign for something health related? Hopefully that's not too much of a brain buster for you, and I really look forward to your answers.